COVID-19 cases have been rebounding in recent days here in Korea in what appears to be a summer surge sparked by waning immunity and public activity. Our Hye-ryeon reports.
COVID-19 is showing a resurgence here in South Korea with the number of cases rising for 4 weeks straight, which could throw a wrench in the government's plans to lower its risk rating. Data released by the Central Disease Control Headquarters on Sunday show that cases rose by more than 35% during the third week of July compared to the week before. Figures for July have shown significant increases week by week, rising from just over 150,000 in the first week to the latest figure of 253,000, meaning that the number of cases has seen a more than 60% rise over 3 weeks. Daily figures are hovering near the 50,000 mark, hitting over 47,000 on July 19th. It's the highest daily tally seen in the country since November last year, when daily figures peaked above 54,000. The current dominant subvariant of the virus in circulation is XBB 1.5, and while the vaccine against this new strain is set to be made available in South Korea in October, the low vaccine rate seen last winter among those aged 60 and over means that this may not be so effective for herd immunity. Experts say that this, coupled with the hot weather, is contributing to the rise in cases.
The rise in numbers can be attributed to the XBB strain, as well as the fact that the government has now proclaimed it an endemic, prompting people to return to normal life without masks. The heat means that more people are choosing not to wear masks too.
The latest data comes as the government announced last Wednesday its plans to lower COVID-19's risk rating to the lowest level on the infectious diseases risk classification scale as part of its three-step endemic roadmap. Currently it's ranked Class 2, which is the second highest rating alongside other highly infectious and high-risk diseases like cholera and tuberculosis. Being downgraded to Class 4 means that people will no longer have to report to the authorities within 24 hours of testing positive, and the indoor mask mandate at hospitals and nursing homes will be lifted. With it looking likely that numbers will continue to rise in the second half of the year, the government may need to form contingency plans.
The number of cases will rise exponentially when the weather gets colder and less humid, and when school starts up again in September. The government's plans to halt testing and cut financial support doesn't seem appropriate at this stage.
The Korea Center for Disease Control and Prevention will be monitoring the recent data and holding an advisory committee meeting before it implements the decision early in August. Hye-ryeon, 아리랑뉴스.